Care, Education and Treatment Reviews. Introduced in March 2017 as part of the Care and Treatment Review Policy Update in order to reflect the role that education plays in the lives of children and young people, a Care, Education and Treatment Review, commonly known as a CETR, is a meeting about a child or young person who has a learning disability and or autism who is either at risk of being admitted to or is currently detained, also known as sectioned, in an inpatient psychiatric service, either within the NHS or in the independent private sector. Care, Education Treatment Reviews bring together people who are responsible for commissioning, that is paying for, and providing services. This may include nurses, social workers, education, health and social care professionals, along with independent clinical opinion and someone with lived experience of children and young people and families living with learning disabilities, autism or both. They also provide an assessment of children and young people's care, education and treatment in the community if they are at risk of being admitted or in an inpatient setting, to identify the factors that are preventing their timely discharge or preventing adequate and safe support being provided where they live. At every CETR, there will be a review panel with the responsibility for making sure that everything that needs to be discussed is discussed. The panel is made up of 3 people, a chair, which is usually someone able to make financial decisions, a clinical lead with a clinical background, and an expert by experience who may have autism, a learning disability, or lived experience as a family carer living with either condition. The CETR will provide information and evidence that helps the panel to provide a summary and feedback for the child or young person that tells the review panel if they are safe, what their current care is like, what plans are in place for their future, and whether they need to be in hospital for the care and treatment. The CETR will also inform the review panel if there are areas of concern, if the child or young person is receiving the right care, education and treatment, if the child or young person is involved in their care, education and treatment, if the right medication is being used, and if parent carers, family members and other carers are involved. The child or young person should always make a contribution to, or where appropriate, attend the review themselves. They should be provided with the information and support necessary to enable them to do this. Parent carers, or those with parental responsibility for children and young people, should always be part of the review, unless there are exceptional circumstances or significant safeguarding reasons to prevent this. The CETR can be requested at any point where there are concerns regarding suitability of the service, the treatment plan, the individual's safety and well-being, and or if there is no clear discharge or transfer date and plan. This can be whilst the individual is living in the community or within inpatient services. The request for a CETR can be made by a number of people, subject to necessary consent and age, including the individual in receipt of services, the individual's family or carer, the responsible commissioner, the advocate for the individual in receipt of services, or the team who are supporting the individual either from the inpatient services or within the community. So what happens at a typical CETR? The CETR review panel tend to meet first in order to read details of the history of how or why circumstances have got to where they are. This may include reading reports from CAMS, Education Department, GPs, psychiatric reports, social services and medical records. This gives us a good background and introduction to the issues facing the young person. We may then discuss between us what we feel are the main areas of concern and why we think things have got to where they are. This can also direct us to where we need to ask particular questions and who to. Depending upon when the young person and or family members or carers are available, we may then meet the young person and or somebody closely connected to the young person, where we will chat as freely as possible to find out from their point of view what the issues are. We may then start to invite professionals into the meeting, where we will spend a great deal of time asking them questions and allowing them to give up-to-date reports. The young person and or family members or carers are more than welcome to remain in the meeting throughout. The review panel then meet alone in order to discuss recommendations and actions we feel are necessary to ensure a positive outcome for the young person and or their family.